I'm Dr. Zantua. I'm the Assistant Medical Director of Advanced Medical. I had the opportunity to work with a family from India. The patient is the mother who is in her early 40s. She has been asthmatic for the past 20 years and has been having almost daily symptoms, however, has not really been compliant with her medical care. She had no other significant past medical history other than bronchial asthma, and she is a non smoker. She is on as needed albuterol in the form of an inhaler or a nebulizer, which she uses 3 to 4 times in a week. And despite of this, has not seen a doctor because of her asthma symptoms. She is what we call a poor perceiver of her asthma symptoms. Last July, she had one of her nightly attacks, um, but this time she requested to be brought to the hospital after her rescue medications didn't seem to work. En route to the hospital, she lost consciousness and apparently stopped breathing. It took around 15 minutes for the husband to bring her to the closest hospital. Once they were there, she presented in a cardiac arrest and CPR was initiated. She had a return of spontaneous circulation after a few minutes of CPR, and she was eventually placed on ventilatory support and hypothermia protocol was started. The next few days, she remained to be comatose. Diagnostic tests, which includes MRI of the brain and EEG, were entirely consistent with hypoxic insult or injury to the brain because of the lack of oxygen. The husband was told that his wife had or has hypoxic encephalopathy and that the prognosis is poor. It was at this time that the family has decided to reach out to Advanced Medical for advice regarding management options. We have reached out to two new neurologists who provided their expertise and guidance on management. I had the opportunity to talk to the treating physician, and their team were very appreciative of the experts' inputs, as this has given them a venue to discuss the patient's condition, and they were also given options for management. On follow up with the family 2 months ago, the patient has greatly improved. She has regained some of her cognitive function and, in fact, is able to meaningfully interact with the rest of the family members. She's also able to walk, albeit with assistance. The main problem that they have now is that they felt that the patient has been having a lot of jerky movements, and this jerkiness has impaired with their further recovery. So we sought new experts, this time movement disorder experts, who diagnosed her to have post-hypoxic myoclonus jerks, which is part of what is known as the Lance Adams syndrome, and this is because of her history of brain injury. So these new experts have given treatment options that the patient and the team can try to improve her symptoms. The patient's recovery has been very impressive, and the husband is very thankful to have Advanced Medical, and he felt that his wife's management has been greatly improved because of our contribution. He knows that his wife's recovery is going to be arduous and slow, but knowing that he has Advanced Medical to reach out throughout the entire process, he knows that they will always be on the right path. The family felt very grateful and were impressed by the experts and the services provided by Advanced Medical.